The ability to help people sort out their lives and have meaning and purpose is profoundly important work and a profound privilege. And I love doing that. This is a sector that changes people's lives in a fundamental way. But we get one time to be alive. And if you're working in healthcare, you are keeping people alive or giving them a quality of life. I don't think there's anything more valuable than that.
Healthcare definitely isn't for everyone. I mean, I think if you're just looking for a job or you just want money, it's not the right job for you. I think it's something that you really have to want.
It has to be more than compensation. It has to be more than people's gratitude, because you won't always get it. You really have to have a sense of a higher purpose for it.
If someone's doing it for status, for example, I think they won't last in their career for very long, or they will be unhappy.
It's really important to know why. Why do you work in healthcare? And there's so many reasons people can choose to. For me, it's always come from a place where it's a privilege to try to help others.
The way I see it is that you're doing it for more than just the job and the money, right? Like, you want to do good. You want to do good.
I get a lot out of being able to be there with a patient or their family on their worst day. And in the ICU or the emergency department, most people that are here are having their worst day. And so I might not be able to fix the problem or make it go away, but maybe I could make them feel less alone, or help them have a better understanding of what's happening to them, or maybe help them feel like they have more, at least some choice or some small semblance of control in a really out of control situation. Or maybe add dignity or help soothe pain or something, which might even be very small, but could be very impactful. And I think that's something that fills my work cup.
What really fills my cup about this job is simply taking a moment to have that human connection that is so integral to being able to respect that person's humanity as they're going through usually their worst crisis of their life.
I can say there are certain people that I've looked after that I care deeply for, and I try to do my very best for them.
I decided to become a nurse because I like to help people. I also wanted to provide for my children and make a living for them. I wanted them to have experiences that I never got to have. And I just wanted to bring more to our community as well.
I draw a lot of inspiration from working with patients and families, and trying to make the better system better for them, because that's why we're here.
I don't think there's another job that I would rather do. I definitely, when I look at all the other jobs that are out there, more 9-to-5s or office work or labor work, there's honestly, it's, even though it was tough and not easy, I don't think there's anything else that I would rather be doing right now.
I mean, there's nothing better in life than feeling that you're working towards change and you're making a difference.
When anybody tells me that they want to become a nurse, I tell them, you should do it. We need nurses right now, and it is a hard job. It's very hard. And I try not to sugarcoat it because they need to know what they're getting into. I just explain to them, sometimes there's stuff that I just really love about my job, and sometimes there's stuff that I'm just really, where I'm like, oh man, why am I in this profession?
Some things that I find really enable me to keep on coming back to work are that, first, I have the best colleagues. I work partially in the emergency department and partially in the intensive care unit, and I work with the best teams that look out for each other and have each other's back. There's something really bonding about the work that we do together. I've made lifelong friends through my work.
The richness of the job comes from working with, treating people, having colleagues with whom I can work, and the opportunity to really have an impact upon people's lives in a positive way.
I became a paramedic because I like to problem solve. I like to lift people up and improve their day, really. My 90% of this job as a paramedic is talking to people and having communication, and that's fundamentally who I've always been.
The beauty of the job is it's so diverse. You can do so many different things, and I've done a lot of different things within the scope of nursing. Being an ICU nurse meets kind of my own personal needs of being a geek, and also because I love people. So that's partly why I've come here and stayed, because it's so interesting and it changes all the time.
You have really good relations with the physicians that you work with, and like amazing nursing staff in either places. And for me, it's just a lot of fun to be in a workplace where I feel like I'm not working with coworkers, but I'm rather working with friends. And I think that kind of solidifies it for me, just being able to be at work and be like, hey, we all love the challenge. We all, for me, like it stimulates my mind to go in there and learn new things every day, and do the best that I can. And like, obviously, as healthcare workers, I really enjoy helping people, and I really like seeing people thrive.
I've been so fortunate in my time in healthcare that I've been able to not only work as a frontline nurse in different roles, but I've also had the privilege of being parts of different kinds of projects that have really improved outcomes on a broader scale. And so there's some real satisfaction I've been able to get from being able to know, hey, this thing we did made a difference in all these people's lives.
So I looked for a change, and I found home health. And I thought, I'm going to give this a whirl. I'm going to give it 6 months, see how it is. I fell back in love with nursing. I just love to give back to people and help people. And that's where I found it again, was in home health.
Being able to collaborate with people under challenging circumstances can be quite rewarding. And I would say that it makes the job not boring.
I still feel like I learn something new every day. Sometimes I learn a lot of new things, and I love that about my job. And as a CNS, as a clinical nurse specialist, my job is essentially to try to make something better for somebody every day, and that's a privilege, and I feel grateful for it.
There is no better opportunities, and there's no better career than within healthcare.
If you love it, healthcare is a great job to be in.
I don't think there's any more noble calling than healthcare.
For people who are driven by helping others, this is the best place for you to be. That opportunity of even knowing you're making a difference, even for one person, gives you the fuel to do all the rest.
It is such an honor to work with such an amazing group of people. You know, we are in some ways all paddling in the same direction, and you don't get that often.
If you're thinking of doing it, now's the time to do it, and you could never find a better work family than a group of healthcare workers.
If I could do it, you definitely could do it too, because we can change the world.